Today I'm going to be talking about the ineffective communication that goes on between doctors, physicians, as well as nurses. Ineffective communication between nurses and physicians has affected patients as well as it affects their mental state and the stress levels of the medical staff. There are strategies that can be placed that will better develop communication between nurses and physicians, and it can help them to better treat the patient in the long run. The possible situation of ineffective communication between nurses and physicians can cause negative and dire outcomes to the patient's health, which in the medical field, the patient is always placed first and they should always come first before any type of miscommunication between the two or a dispute. Miscommunication between nurses and physicians can be contributed to many different factors, and one I want to point out is the training they have in school before they are even placed in a stressful situation. Nurses and physicians are usually trained separately on their job specifics, on their job duties, and how they're going to interact with one another. They are trained separately in a book, or they are trained just reading a PowerPoint on what their specific job duties are, and they aren't properly trained on the communication that they need to be having with one another and how to form that communication from their first meeting or when they are thrown together in a stressful situation. There has to be strategies to communicate with one another so that they universally know what to do if they are thrown in that situation. Nurses and physicians, what some schools are doing is training them together, and not all schools are doing this, but some have started to train them together when they are talking about the specific job duties of one another and how to communicate with one another, and having them interact with one another on patient dummies or in rotations or in the hospital. They're having these students train together so that before they are finished with schooling and they're thrown in that situation, that they know how to communicate with one another. There is not one specific pinpoint on what causes miscommunication between the two, but one I have found doing my studies is changing shifts. So when night or when day shift switch, that's when miscommunication is usually at its highest, is when there's changing shifts. So what I think needs to be done is they all need to come together and communicate with each other on each patient that they're going to be transferring over to the other medical staff. And another one is just normal disputes, or some doctors, not all, but some do feel that they have more authority and power over nurses, and that they can overrun everything, and they just don't communicate at all. One other thing I want to talk about is how physicians and nurses need to form as a pair of gloves. They need to come together to provide the best optimum outcome of patient care. Miscommunication, if it continues without having attention and solutions to one another, the patient will suffer the consequences, and their health will deteriorate if there is not better communication, like giving the wrong drugs if they're not communicating correctly, or doing the wrong stretches, or being placed on the wrong medication, or being placed on the wrong ventilator. This can cause very, very, very bad health outcomes for the patient. Training them together in a school before they are thrown into this stressful situation can better have them communicate with one another before there is a patient on the line. I have personally gone through this myself. I was in EMT school, and I did rotations and rounds in hospitals, as well as training on scene before taken to the hospital. I have personally seen what miscommunication has done to a patient and what good communication has done to a patient. I have been doing CPR on somebody, and there has been miscommunication between my partner, and this negatively impacted the patient and how long there was oxygen going to the brain. Now, patient was fine, but that one miscommunication really led me to better communicate with my partner and how we address things and how we run things when we are with a patient on scene, or when I was doing rounds in the hospital, when I was watching communication between physicians and nurses. Some would have to go double check. Double checking is the best thing you can do in the medical field. You just need to double check and better communicate with the doctor to make sure that you're doing the right thing for the patient. Having better communication and putting steps in place will better serve the patient, as well as give the nurses and physicians a healthy line of communication with one another. Being in that high of stress can really cause negative impacts on day-to-day life, on being in the hospital and having to work with these people every single day. This really needs to be made a priority, and it can give the best outcome for the patient, which the patient's health should be placed first.